Next up, we have Nick Telesco from ASCO, American Society of Clinical Oncology. He supports state-level policy initiatives aimed at improving access to high-quality, equitable cancer care. And in his role, he works closely with oncology professionals, state affiliates, and policymakers to advance legislation on issues such as prior authorization, Medicaid access, copay accumulator reform, and other policies that impact cancer patients and oncology practices. So welcome, Nick. Thank you.
Good afternoon, everyone. I am the anonymous ASCO representative listed on the agenda. My name is Nick Telesco, State Advocacy Specialist at ASCO. I will be given an update on ASCO's advocacy efforts so far in 2026 at the federal and state level, as well as an update on our grassroots activities. And thank you, Dr. Sheen and Dr. Finn, for having me here. This is actually my first time in New Orleans, so super excited to be here and happy to get out of DC for a few days. Even though my focus is state advocacy, I can provide an overview of the political climate at the federal level and ASCO's priorities this Congress. Republicans currently control the Senate with a majority of 53 to 47, while Republicans have also maintained a narrow majority in the House, 218 to 213. Speaker Mike Johnson of Louisiana was reelected as Speaker of the House, and he has been dealing with 3 vacant seats as of February. This slim majority makes passing legislation very difficult and complicated for Speaker Johnson. Congress also has a limited time to legislate this year before they leave DC to go campaign ahead of the midterms. We anticipate very little legislating this year, which, if you've been paying attention to the national news, is probably not a surprise. But there are just very few legislative days this year and extra in-district work periods. That being said, after a few government shutdowns, Congress finally passed a FY26 funding budget, and that includes $47.2 billion in funding for the NIH, $7.4 billion in funding for the NCI, and $1.5 billion in funding for ARPA-H. This funding package also included a 2-year extension of Medicare telehealth flexibilities, in addition to other provisions ASCO was supportive of. ASCO tracks a long list of issues and monitors a lot of bills at the federal level. However, we have to prioritize limited resources to the areas we think can have the greatest impact. These are the policy areas prioritized for action in 2026. Setting these priorities is a combination of not only the issue itself, but the potential political opportunity to get something done. Congress is just now beginning the appropriations process for FY27 funding. ASCO is working with coalition partners to advocate for robust funding for cancer research. ASCO continues to advocate for the Connect for Health Act, which would permanently extend Medicare telehealth flexibilities, and is also advocating for the Improving Seniors Timely Access to Care Act, which would streamline prior authorization processes in Medicare Advantage. Both bills do have broad bipartisan support this Congress too. Additionally, ASCO is working with coalition partners and congressional staff to enact a comprehensive solution to address drug shortages, as well as Medicare physician payment reform. Our priorities at the regulatory level do mirror our priorities both on the Hill and in the states. For prior authorization, some provisions in the electronic prior authorization rule began to take effect earlier this year. These requirements, though, will only apply to Medicare Advantage, Medicaid, and ACA plans. Effective the beginning of this year on Jan 1, insurers will have to comply with new timeline requirements, including 72 hours for expedited requests or 7 days for standard requests. Insurers must also give a specific reason for denial and report certain prior authorization statistics, including approvals, denials, appeals, and timeframes, and that also must be publicly listed on their website. except for ACA plans. They do not have to comply with that requirement. The actual electronic prior auth process will go into effect on Jan 1 of 2027. These requirements will only apply to services. However, there is a new regulation under review at OMB, and we anticipate that will address drugs and electronic prior auth. Moving on to Medicare payment, under H.R. 1, Congress gave the CF a 2.5% increase, but only for this year. Even with this bump, though, the CF is still roughly $3 less now than what it was back in 2020. Additionally, the 2026 Medicare Physician Fee Schedule final rule created significant disparities in reimbursement based on where an oncologist provides a service. On average, office-based clinicians will see a 9% increase, while those in hospital-owned practices face an 8% decrease in 2026. And lastly, our last priority at the regulatory level is working on the implementation of Medicaid work requirements at the federal level. Beginning Jan 1, 2027, Medicaid expansion states will have to implement work requirements for Medicaid beneficiaries. Those who are either medically frail or who have a complex medical condition are exempt from these requirements. Our focus at the regulatory level is working with CMS to ensure cancer patients fall into either one of these categories so they don't have to comply with the work requirements. Additionally, CMS is required to release an interim final rule in June of this year. ASCO has been meeting with CMS staff and leadership and has been submitting comment letters with our recommendations specifically regarding cancer patients and providers ahead of the June deadline. Moving on to one of my favorite topics, state advocacy. This year, 46 states and DC are in session. Over a dozen states have already adjourned for the year, and by the end of June, only a handful of states will remain in. Louisiana session, your guys' session began earlier this month, and you're set to adjourn at the end of June like most other states. For partisan control of state governments, it has stayed roughly the same since November elections in New Jersey and Virginia. Republicans currently control 23 state governments, Democrats control 16, and 11 states have divided governments. Several states are also grappling with really significant budget deficits. Some have deficits into the billions of dollars this year. And because of that, it really poses a challenge to getting any bill with a fiscal note passed because states have to have a balanced budget, much unlike the federal government. And it's also important to note that 2026 is an election year in most states. About 6,000 of the roughly 7,300 state legislative seats are up for election this year, in addition to 39 governorships. State activity is typically lower in these election type years, so members can go out and campaign in their districts. But I will note, Louisiana, you guys are one of the 7 states that don't have elections this year. On the screen are our state advocacy priorities for this year, which do closely resemble our priorities from 2025. Although our biggest focus is going to be on protecting access to Medicaid as states begin implementation of H.R. 1. We developed these priorities based on discussions with state societies, coalition partners, and ASCO members. When I made this presentation at the end of February, we were already tracking over 500 bills across the country and had sent 50 letters to state policymakers. Now that we're in mid-March, we're almost at 100 letters to state policymakers, and by the end of June, I'm afraid to know what that number will be. We have heard from multiple state affiliates and coalition partners that, again, a lot of states are grappling with really significant budget deficits because federal funds are drying up and states now have to implement H.R. 1 and all of the cuts that come along with it. In terms of Medicaid, our primary focus this year is ensuring patients with cancer are exempted from the 80-hour-a-month work requirement under H.R. 1. Although we also remain very concerned and anticipate states are going to cut Medicaid provider reimbursement rates, and we're also monitoring potential cuts to benefits, as well as the implementation of required cost sharing under Medicaid for Medicaid beneficiaries. Louisiana is a Medicaid expansion state and will have to implement those policies under H.R. 1. ASCO and LOS, the Louisiana Oncology Society, have already started to have conversations and work together to address the policies and the impacts that they will have on patients with cancer. We're also anticipating an increase in the proliferation of non-ACA compliant health insurance plans as people move out of the marketplace due to the end of the enhanced premium tax credits. ASCO opposes these so-called junk plans because they often fail to provide comprehensive coverage for people with cancer. In Louisiana, so far, we are currently tracking 13 bills on a variety of issues, including prior authorization, PBM reform, and we're also monitoring implementation of H.R. 1. I also want to give a shout out to Dr. Sheen and Dr. Donald for all of your advocacy in Louisiana. We love to see members getting engaged in state advocacy and how important it is. To kind of delve a little bit deeper into our main focus for this year in defendant access to care, our top priority is preserving the coverage gains made through Medicaid expansion and defending eligibility as states implement the administrative barriers, especially through work requirements. These requirements often fail to account for the realities of illness or caregiving and historically lead to a significant portion of eligible patients and caregivers losing coverage, not because they don't qualify, but because of the administrative and paperwork burdens. As you all know, for cancer patients, a lapse in Medicaid coverage is a matter of life or death, potentially interrupting chemotherapy, radiation, or critical follow-up care. Our priority is to actively oppose these administrative barriers and prevent any policy rollback, ensuring Medicaid remains a reliable lifeline to cancer patients. We have already weighed in on a number of restrictive Medicaid bills, Section 1115 waivers, and state plan amendments throughout the country. And these are all states attempting to get ahead of the federal deadline and implement these policies before the federally mandated start date of Jan 1, 2027. Secondly, we are concerned about severe Medicaid provider rate cuts, as I mentioned earlier. When state reimbursement rates drop too low, specialized cancer centers, infusion clinics, and rural hospitals may be forced to either limit the number of Medicaid patients they accept or risk closure. I'll highlight that the reduced reimbursement rates not only save the state money, but they translate directly into longer wait times, increased travel distances, and ultimately decreased access for patients with cancer. And lastly, as I mentioned earlier, we anticipate a lot of action on protecting the core ACA consumer safeguards that have fundamentally changed care in the US. There has been an increasing trend of encouraging individuals to leave their marketplace plan and instead turn to these so-called junk plans. This includes short-term limited duration plans, Farm Bureau plans, and healthcare sharing ministries. And none of these plans have to comply with the ACA's essential health benefits. Given this, these plans often lack coverage for cancer screenings and discriminate on the basis of pre-existing conditions. We are concerned that these inadequate health plans can become a major barrier to receiving appropriate and timely cancer care, and we have already weighed in with concerns on a number of these bills throughout the country. So we are working with a number of coalition partners on these issues, and we're working together to ensure that patients are able to continue to have access to Medicaid and high-quality health care. ASCO also released a new position statement specifically addressing the new Medicaid policies established by H.R. 1 and how state policymakers and regulators can implement these policies to protect patient access to Medicaid as much as possible. So you can get involved in our advocacy priorities by visiting ASCO's ACT network. This is our online advocacy platform that includes a lot of really helpful information. It includes action alerts on ASCO's policy priority issues. Each alert includes a background on the issue, including ASCO's legislative ask or message, as well as pre-drafted letters you can send to your lawmakers, but you can also edit the letters to include your personal experiences with the issue or any stories with it. It also includes our federal and state bill trackers, which highlight the bills that ASCO is currently monitoring and actively engaged on. The state map is also really cool and my personal favorite feature because it highlights, because you can click on each state to see the state-specific bills we're tracking, and it updates in real time too. And then lastly, it also includes state fact sheets with useful cancer information for all 50 states plus DC. And some of the information it includes is the number of practices and oncologists in each state, the amount of NIH grant funding each state receives, as well as the uninsured rate, Medicaid beneficiaries, and more. You can scan the QR code on the slide to visit the ACT network. If you are an ASCO member, be sure to visit the Preference Center to make sure you are opted into receiving ACT network alerts so you don't miss timely opportunities to engage with your lawmakers. ASCO also established the ASCO Association PAC a few years ago, which helps engage and educate lawmakers from both sides of the aisle. In 2025, the PAC supported 62 congressional candidates, including 10 physicians in Congress. The ASCO PAC supported 4 new physician candidates running for Congress for the first time this election cycle. They include Dr. Amish Shah, a Democrat in Arizona, Dr. Matt Klein, a Democrat in Minnesota, Dr. Ralph Alvarado, a Republican in Kentucky, and Dr. Thomas Fisher, a Democrat in Illinois. The PAC is looking to double the support for new physician candidates for Congress to 6 this cycle, and we're at 4, so we're already more than halfway there, and the PAC is looking at other viable physician candidates to support this cycle. The PAC dispersed about $109,000 to support cancer care champions just last year alone. And these disbursements enabled ASCO lobbyists and volunteer leaders to attend over 85 PAC events last year and have direct interactions with members of Congress and their staff over 100 times. You can learn more about the ASCO Association PAC by scanning the QR code on the screen. So those are all of my slides. I wanted to leave time to take any questions or comments from the audience. And my email is also there in case you have any questions after the session.
So I'll ask the question. Yeah. Okay, sorry. So with the new policies for states who have Medicaid expansion, as Louisiana does, and the new requirements for HR1, how are y'all seeing that impact more red states that may have had a governor that approved Medicaid expansion but now don't?
Yeah, that is a concern. We already have seen attempts in some states to repeal Medicaid expansion. Oklahoma has a resolution moving through that would repeal it in their constitution. Similarly, so does Missouri and I believe South Dakota and Idaho. So those are all things we are very concerned about, and we have been tracking those. I think luckily in some of those states there is other leadership in one of the chambers who is resistant and opposed to those efforts. And we've also been working with coalition partners. We are a member of the Modern Medicaid Alliance, which is specifically focused on Medicaid expansion and ensuring patients have access with all of the fun stuff in HR1. And our team also meets pretty regularly with national staff from ACS-CAN and Blood Cancer United too. And they've been great resources.
What is the chance that they will halt providers or adequate providers available and accessible to patients?
Yeah, I think it really is a state-by-state approach. We have seen some states start to cut reimbursement rates for certain services, but have not yet seen oncology-specific cuts. And so that's something we are continuing to track and monitor, but we haven't seen any so far yet for oncology-specific.
I know for surgery, but surgical oncologists, there's CMS cuts 2.5%
Yes.
in perpetuity every 3 years because the idea that as you get more experience, you can do surgeries faster and hence you don't need to be reimbursed properly, which is obviously not the case. And it just went into effect January 1st.
Yeah, our federal team does have Medicare physician payment as one of our priorities, and we do work with coalition partners on this issue. I don't believe there is any sort of comprehensive package moving through Congress. I think there's still very much initial conversations, unfortunately, and trying to educate lawmakers on the impact of the cuts. I think I saw another question, yeah.
This is regarding affordable care act. Tax subsidies. This is, I believe, a few months ago.
Yes.
Big issue, the government shut down. Democrats wanted to extend those subsidies that expired recently. There's a lot happening right now. Do you have any updates on that, or where those subsidies stand for DCA?
Yeah, I would have to check with our federal team who follow it a little bit more closely. But I think it would be very surprising if those subsidies do end up getting extended. I think some of the conversations have kind of fizzled out by now. There was some talk a few weeks ago about a potential package, but I don't think that was close to coming to fruition. Okay, well, thank you.